I'm Dr. Tim Murphy, Director of the UB Clinical and Translational Science Institute. The vision of our institute is to perform innovative research to improve health in our community and the nation. So our activities are closely tied to our community. Performing clinical research is important to our community for several reasons. It affords our population access to the latest treatments and technologies. We know that the best healthcare goes hand in hand with the best clinical research. So growing our clinical research enterprise helps to raise the level of healthcare in the region. We are supported by a $15 million Clinical and Translational Science Award from the NIH to support our faculty and trainees in the Buffalo Translational Consortium in performing their research. The Buffalo Translational Consortium includes 17 partner institutions. The 5 UB Health Sciences schools are important clinical partners, including Kaleida Health, Erie County Medical Center, Roswell Park Cancer Institute, and UBMD, the practice plan of the medical school. In addition, we partner with important research institutes on the Buffalo Niagara Medical Campus and influential community partners to help tie us to our community in all of our activities. To that end, we've established core services that provide expert assistance and support in key areas related to clinical and translational research. The cores can be accessed easily from our website, buffaloctrc.org. You create an account using your UB login credentials or by setting your preferred username and password if you're a researcher at a partner institution. Logging in will take you to this page where you can choose which core service you'd like to access. The cores include BIRD, that's Biostatistics, Epidemiology, and Research Design, Drug Development, Community Engagement, Imaging, which includes state-of-the-art MRI and PET-CT, Education and Training Activities, Laboratory and core facilities throughout the consortium institutions, and Clinical Research Navigators. Clinical Research Navigators are an especially important link in that connects you with support for all aspects of clinical research, including the many services and support in the expanding Clinical Research Office. You fill in the simple online form, give a brief description of the support you're looking for, and an email will automatically go out to the core staff. Our goal is to have an initial response in 1 to 2 working days. These services are available to faculty in the Buffalo Translational Consortium institutions, including UB and Roswell Park. The core services are available to support funded research, to develop preliminary studies for your grants, to perform pilot studies, and to support scholars and trainees in the Mentored Career Development Program. In most cases, these services have no cost, with the idea that core faculty will be included on grants when appropriate, when they're funded as a result of support for the preliminary studies. The success of our CTSA depends on the success of our faculty and trainees. So we ask that researchers who use CTSA services cite the grant as noted on this slide. The slide shows the types of support that would lead to citing the CTSA, like pilot studies, use of core services, any interaction with the Clinical Research Office and the IRB. This language is also available on our website that you can copy and paste. Our 5-year vision is that clinical research will grow and be recognized for raising the level of healthcare in the region and thus attract more patients into our healthcare facilities. It's the outstanding research of our faculty that will allow us to realize this vision. On our website, you'll find videos from all of our core directors to detail the specific support that they provide. We look forward to working with you to enhance and support your research activities, which will lead to improving the health of our community.